You hear my voice. You know everybody who's sneezing and coughing right now. I bet you don't realize it is RSV season. RSV is a respiratory virus similar to a common cold in healthy adults, but for infants, older adults, and immunocompromised people, it could lead to serious complications. Meghan Faulkner is a doctor of nursing practice, a pediatric acute care nurse practitioner, and a clinical instructor at Rutgers University. We say good morning, Meghan Faulkner.
Good morning, Ken. How are you?
Great, good to have you on. And I have to ask you to tell everybody, please, what RSV is, what kind of a virus is this, and why certain groups need to be more concerned than others.
Sure, absolutely. So, respiratory syncytial virus has been around as long as I have been a nurse practitioner and beyond. It is a virus that causes upper respiratory symptoms like cough, cold, very thick mucus. I almost liken it to Elmer's glue, and fever. So, in a normal, healthy adult like myself, and I'm assuming you, we would just have symptoms of a common cold. However, in very small infants, in particular neonates, those fresh ones that have just come to the world from us, and then also for older adults who are immunocompromised or anyone with a pre-existing lung condition, RSV can come along with some very serious complications and require hospitalization. So back when I was a nurse, starting in 2007, we had kids coming in droves requiring intubation, being put on mechanical ventilators and spending weeks in the hospital due to this virus. But in recent times, we've had introduction of a monoclonal antibody, which has really changed the game of RSV in general in the last 2 years.
And we started hearing about monoclonal antibodies being given to people with COVID right in the beginning when we didn't know how to treat it, and we didn't have the COVID vaccine or vaccine. I put in air quotes, however much of a vaccine it is. But I'm not trying to discount it, but it
It's
didn't
okay.
turn out to be quite as good as we thought. But nonetheless,
Mhm.
um, but and that's not discounting all vaccines. I want to clarify that I'm not an
We could
anti-vaxxer
speak
at
about that a
all.
different time if you want. Yeah.
Yes, yes. Well, I'm very, very pro-vaccine. I'm not
Yeah.
anti-vaccine. But in this case, uh, parents should be looking out for certain symptoms, especially in their children. So, what are those symptoms that they should be looking out for? Is it that thicker phlegm that they may have that could cause RSV? It could be RSV, which could lead to a very serious infection for their children.
Yeah, so the biggest problem with small infants and in neonates as well is not only that they don't have built up immune systems, but their anatomy is as such that I bet you can, in the last couple of days, you've been able to cough up any of the mucus that's been stuck in your lungs or blow your nose to evacuate your nasal passageways. Well, little babies can't do that. So, what that means is there can be mucus plugging inside of the lungs, and that leads to a condition called bronchiolitis that make it very difficult for them to breathe. It can lower their overall oxygen levels, and that is usually what requires hospitalization in general for respiratory syncytial virus. And even in very, very small newborns can stop breathing and have periods of what we call apnea as a result of viruses like this. So it can really vary, but parents should be on the lookout for any color changes anytime their infant is using their head or all of their muscles to breathe, or if for some reason they're more tired or not eating and drinking as much, that is cause to bring your child to medical attention.
That is interesting. And just quickly to talk about the monoclonal treatment, the FDA approved it now, right, for RSV treatment. So does that mean that most insurance companies are finally covering it?
Absolutely. You have to qualify. So historically, we did have a different kind of monoclonal antibody. And just to be clear, the difference between a monoclonal antibody and a vaccine is that the antibody is going to help prevent you from developing complications of the virus. It is not necessarily going to stop you from contracting the virus, which is very important. And I think why most individuals got very upset over the COVID vaccine. But we have seen a huge change in the game with the RSV monoclonal antibody. Normally, I have droves of children coming into the hospital, and I can tell you right now, we are seeing far less children being hospitalized for RSV. So any infant now can, up to age 8 months, can qualify for the RSV monoclonal antibody. If a child is going into their second season and up to 19 months, they can also receive the monoclonal antibody. And then any adult who is immune compromised or has a pre-existing condition over the age of 55 can also get it. And any adult over the age of 75 can qualify. So people should really talk to their providers about eligibility, and it is certainly available and covered by most health insurances.
And then also, look, as a nurse practitioner, I'm sure you, with all the number of people that you've probably been seeing, an awful lot of folks coming in with all sorts of respiratory viruses right now, especially for anyone over 55. How essential is it that they get their flu vaccine, that they get their pneumonia vaccine? Too many people I know don't think they need a pneumonia shot, but how fast, especially if somebody is sedentary, how fast can a respiratory virus turn into pneumonia for older people?
I mean, it's a matter of days, right? So starting with symptoms on day one and being hospitalized by day 3 or day 4, especially with sedentary lifestyles, the flu kills healthy people. I'm here to tell you, I have seen it kill healthy children. And the only thing that we have in our arsenal to protect is the flu vaccine. So that is one of the biggest proponents for me as a pediatric nurse practitioner in the pediatric intensive care unit. You can spare yourself that horrific heartbreak and nightmare by getting your child the flu shot, and your loved one, especially those who are older and immune compromised, the flu shot as well. You can walk into any pharmacy at any time. As long as the pharmacist isn't on a lunch break, you can get yourself the flu shot.
It's too easy. It's too easy to not get it. I
Mhm.
put in my calendar a repeating thing. The third week of September every year is when I get my flu shot. I know that's just I just mark out a day, and if I'm not at my CVS or a Walgreens, I just tell my doc, hey, can I get a flu shot while I'm here? And boom, I get it. It's stupid not to get one. You are just risking a serious illness, if not worse, and then perpetuating it by spreading it to everybody else. So just get the damn flu shot and be done with it.
Absolutely.
I've been screaming that to
Yes.
friends for years. What is a website? And by the way, I'm sure it must be frustrating. I have a friend who's a doctor of nurse practitioner, a doctor of nurse practice, nursing practice,
Yeah.
and it's frustrating because I know in the hospital the MDs don't want you called doctor because they're like, we don't want confusion. I will proudly call you doctor because you earned that title and you worked very hard to get it. Doctor, what is a website for more information, please?
So I direct everybody to the cdc.gov website. You can actually look at local flu activity, RSV activity, COVID activity in your area. I know that the CDC website has changed slightly over the last few months, but the information for families, for parents, for caregivers about these viruses, red flags, and how to care for each other
Good
is
deal.
super important. And I'm just going to tell you all, Christmas is great. Wash your hands, and if you're sick, stay home in your PJs and watch National Lampoons. Don't go spread the love to your family that way.
That is great advice. We appreciate you, Doctor of Nursing Practice, Pediatric Acute Care Nurse Practitioner, and Clinical Instructor at Rutgers University. I wish I had you as an instructor. Meghan Faulkner, thank you for coming on this morning. Happy holidays to you.
Thank you, Ken. Happy holidays. Stay healthy, stay safe.
Thank you.